about to do a Blair adjustment. So our wonderful patient has a posterior misalignment, meaning the bone has gone backwards. So we've measured the angles of her bones. We're gonna be standing behind the patient to adjust the bone forward again. So my angles are gonna be 41 degrees, and that's where I'm gonna be standing. My hand's gonna be on her neck, and the table is gonna help me do the adjustment. So this is a really simple and easy Blair adjustment. Okay. Then I can look at the x-ray on this side, make sure that my contact position is proper. And that's it.